Being that it's Thursday morning after 8:30, that means it's time for What's Up, Doc, where we get to spend some time with the experts at Mercy Health, talking healthcare of all different sorts. We have learned so much during the almost, year and a half? Mm-hmm. Yeah, year and a half of doing What's Up, Doc. Had some wonderful folks on. We learned things, and as we pointed out time and time again, they've learned not to volunteer for radio interviews.
Yeah, it's the short straw.
Everybody walks away having learned something. Our guest this morning is Dr. Patrick Para. Dr. Para, good morning to you.
Good morning.
Our topic is the importance of screening for breast cancer. Before we get to all of that, we like to get to know the people who are on with us. Tell us a little bit about you.
Well, I've been at Mercy Health for 3 years. I'm the chair of the Department of Radiology and did a fellowship in breast imaging at University of Illinois. My mom had breast cancer is a reason I decided to follow up in mammography and pursuing this disease.
Was it what happened to your mom that drove you into medicine overall, or that subset?
It was a subset.
So when did you decide to go into medicine?
That's an interesting story. I did my undergraduate at Loyola in Chicago, and just the things started falling into place with my classes and my work and my friends, and got an interest in medicine from them and started applying. And once I started my gross anatomy classes my first year in medical school, I really decided, well, anatomy's great. We started studying x-rays, and at that time CT was starting to come into play, and I found radiology to be very interesting, and just took it from there.
So with connections to both Loyola and the University of Illinois, how conflicted were you during the NCAA tournament last year?
I don't even follow sports.
Okay.
Oh, wow.
Okay.
All right.
Okay.
That's
Good.
how you get through it stress-free.
That is. Just ignore it.
Stressed out? I'm not paying attention to it. I'm fine.
I like that a lot.
I like that very much. October, doctors, you, of course, are well aware, Breast Cancer Awareness Month. You've got to be pleased with the amount of awareness that has been put forth over the last at least couple of decades. We've been talking NFL. They've certainly jumped aboard all that. Why is it so important to keep that awareness increasing for breast cancer?
Well, still, breast cancer is the most common non-skin cancer in American women and the second leading cause of death of American women of all ages. And we do have mammography as the only screening tool proven to reduce the death rate of breast cancer. So the early detection using mammography not only saves lives, but it reduces the severity of treatment that women with breast cancer must undergo, such as mastectomy or chemotherapy. The studies have really demonstrated that the annual mammography cuts the death rate of breast cancer by about a third.
Outstanding.
Impressive. And what's our age when women need to start getting screened?
Well, that's a good question. I know different societies vary, but the American College of Radiology and Society of Breast Imaging recommend annual mammograms starting at age 40, and there's a lot of studies that back this up, because starting at age 40, using an annual mammogram is shown to have a great mortality reduction, about 40% reduction in mortality if we start at that age. The incidence of breast cancer in the age group between 40 to 44 is twice that of the ages 35 through 39. So about 1 in 6 cancers occur between the ages of 40 and 49. So it's a very important age group that we target.
I know. I'm looking at the fact sheet that they give us before we speak with you experts at Mercy Health, and one of the questions that they have on here is what does Mercy Health offer for women with dense breast tissue? That is that's something that strikes close to home with me. There's 3 women that I love who live in my house. My wife being among them, and she is one of those women with the dense breast tissue, and that does make a difference in how this is approached, right?
Yes. We do start with everybody with mammography. I mean, that's key. Mammography and tomosynthesis is always the initial screening tool that we offer. And once we've determined that the patient has dense breast tissue, we have some new equipment that performs an automated whole breast ultrasound. And we use that with mammography to detect, increase our cancer detection rate. We can increase find 2 to 4 more breast cancers per 1,000 patients screened with this. So using the automated whole breast ultrasound in dense breast, it gives us it's performed about 20 minutes, and it allows us to see a larger field of breast tissue and offers a 3D representation of the anatomy and the breast architecture. There's no radiation involved. It's less technologist dependent. And if a patient has a finding, it provides more reproducible results when the patient returns for follow-up.
So that's one other option or way of screening. I guess this is a two-part question. How long has mammography been around, and do you see it being replaced by this procedure or something else we don't even know about yet?
No, because mammography, it's proven itself. The other technology like whole breast ultrasound or breast MRI, those are what we consider adjunct or additional tools to help us. None of these exams, and none are perfect. Technology continues to improve our ability to detect cancer. But it's been around for a while. I look back at the mammograms that were done in the late 80s, and not only were they higher dose, but I wonder how we found cancers at that time, because the technology has just improved so much over the years.
And here's a question, and I'm sure that you have gotten this in the office as well. And you please correct me if I'm wrong, because the sample size I have for this information is somewhat light. Mammograms a little more difficult for women with smaller breasts in the comfort area is what I'm talking about, because this is something that I often hear about is we've made all of these wonderful technological strides. The awareness effort for breast cancer is really at an all-time high. Why hasn't something been done to make that particular procedure a little more comfortable for certain women?
I think now that women get more involved with the development of this equipment, that will likely happen. I think a lot of the early process developed by men may be less sensitive. I don't want to say that is true, but it's possible, it's conceivable that they're less sensitive to that matter, especially in the past. But the compression is very important to the breast. I know and breast tenderness varies among patients. And there's no rhyme or reason. Some are just more tender than others. But the breast compression is very important to us. It actually reduces the radiation dose that's given, and it also spreads out that tissue so we can see masses better. Otherwise, if there's less compression, it's possible that the clarity of the mass may not be visualized.
We're on to talk about breast cancer awareness. It's been how long have we been promoting the breast cancer awareness now? We had about 20 years.
Yeah, it's been a while.
It's been a while.
It went through crime. It became a lot of the legal things came out of a female senator years ago, and I can't remember her name, where they made legal obligations to report, like even now reporting breast density, but also to have insurance coverage for mammography and other exams.
And I think it's been a wonderful campaign. It's gotten it's done its job. It's made people very aware. I did see, and speaking of awareness, I saw a study the other day saying a rise in breast cancer amongst men. How aware should men be of breast cancer?
Oh, absolutely, especially if there's a family history. We're not out of the woods. It is rare, typically over 25 years or so of doing mammography. It's rare. Usually we deal with benign processes in men called gynecomastia, but neoplasms, cancers in men do occur, but I only usually see about 1 to 2 per year. Now that's going to vary depending on your local area, but anytime we, even as men, feel something in our breasts, when we do have breasts, we should pay attention to that and go to our physician and have it checked out. We do mammography and as well as ultrasound on male patients, so it's nothing. Again, people think it's awkward or weird to talk about, but they shouldn't feel that way. If they do feel something or something's unusual or doesn't look right, they should seek attention by their physician.
So a man should that should be a self-check. Shouldn't be worried about scheduling a mammography, even if there's history in their family, right?
Well, they don't have to schedule. We don't do screening mammograms on male patients, correct? But if there are something that person would find either unusual or something they feel, they should bring it to the attention of their physician, because we never know what that's going to turn out to be.
My mom was one of those women who went her entire life, passing away at 84, without ever going in for a breast exam, mammogram, or any of those things. I think believing in her own mind that she would know it, be able to detect it, whatever her reasoning was behind it. There was no one who could really talk her into it. I'm sure you have encountered people like that. What do you say to them?
Well, there certainly has. We've run into patients who, I'm not going to do it because even if they find a cancer, I'm not going to do anything with it. It all depends on their age group. We continue to do mammogram as long as the patient is up to it. Some people say perform mammography till there's about an estimated 10-year survival. But I really tell people don't delay. Mammograms, again, provide early detection. It saves lives. I would ask people, women that do, and specifically do self-breast exams, see their clinician for a clinical breast exam, and have a yearly mammogram. Some of the worst cancers I've seen are cancers that, in patients that have missed their last 3 to 4 mammograms. So they waited 3 to 4 years before they came back, and now they have a large mass.
How early can you guys detect breast cancer in a woman? I mean, is it the day it forms, or do you have to wait a week or so? What was your discovery rate?
No, it's a good question. There's really no. It varies among technologists, not technologists, but the modality. Again, using the whole breast ultrasound helps us find earlier cancers as well. But once we find it, it's been there for a while already. It's even if it's 5 millimeters, but typically at around the 5 millimeter mark, cancers start growing into blood vessels. I don't want to say we can find them all at 5 millimeters because you run into issues with dense breast tissues, and again, these tools help us in varying ways to help find these smaller cancers. And none of these are perfect, but once you do find something, it's been there for a while already.
Yep, October is Breast Cancer Awareness Month. Dr. Pera, where should people go? How should people reach out to either make contact with you to learn more about this topic? You can't get enough information.
Yes. Well, Mercy Health, they can call Mercy Health, and they can get in touch with me through Mercy Health, and as well as the email at Mercy Health. Don't want to give out my specific email or email.
Gotcha. No, I understand. Dr. Barrett, thanks a lot for carving time out of what we know is always a very busy day for you, and it was nice to talk to you. We hope you'll come back on with us again.
Thank you much. Thanks for having me.
He's Dr. Patrick Pera with Mercy Health. It's 8:49. News Talk 1440 WROK.